Hi, I'm Kimberly Trion, and I'm going to demonstrate subcutaneous injection. I'm going to start by verifying my physician's orders, verify the 6 rights of med administration, that I have the right patient, the right drug, dose, route, time, and documentation. I'm going to gather my supplies and do my dosage calculation. Today, the doctor has ordered 1,000 units of heparin sub-Q. It's supplied in 10,000 units in 10 mLs, so we'll draw up 1 ml, and that will give us our 1,000 units in 1 ml. We'll gather our supplies, enter our patient's room, close the door or curtain for privacy, perform hand hygiene. Hi, sir, I'm Kim. I'm going to be your nurse today. Can you verify your full name and date of birth? Verify with 2 patient identifiers. Okay, Mr. Smith, do you have any allergies to medications, food, or environment? Okay. Today, your doctor has prescribed a heparin injection. Heparin is an anticoagulant that we use to treat or prevent blood clots. It basically just interrupts your body's clotting mechanism, which can prolong or even prevent clot formation. Some of the side effects of this medication are going to be injection site pain, and then easy bleeding or bruising is common. Some of our more concerning side effects would be any dizziness, shortness of breath, severe abdominal pain, or nausea and vomiting. Let me know right away, okay? All right. Some people do complain of some burning and stinging with this injection, so just be aware. Do you have any questions? Okay. So we're going to start. We're going to do our hand hygiene and our gloves. All right. We're going to ensure that we have the right needle and syringe. So for this sub-Q injection, we have a 3 ml syringe, and we have a 25 gauge needle. This is a 1 inch, but I would probably consider a 5/8 inch for a sub-Q injection, depending on my patient's size. We're going to start by cleaning the top of our vial. We're going to withdraw 1 ml of air. Place that in there. And we will withdraw our 1 ml of heparin. All right, we're going to tap for bubbles. All right, make sure that we are at that 1 ml mark. So here is our 1 ml. See that? We will very carefully recap that, label our syringe with the medication and dose if we prepare it elsewhere. Next, we're going to select our site. So sub-Q injections, we can give it in the upper aspect, the outer aspect of the upper arm, the abdomen from below the costal margin to the iliac crest, or the anterior aspect of the thigh. Since we have heparin, we are going to choose the abdominal site, making sure that we're 5 centimeters or more from the umbilicus to the left or the right. We're going to inspect our site and make sure that there's no bruising, skin discoloration. We'll palpate for any tenderness or masses, and verify that he hasn't had an injection in that site recently. We'll also test our needle size. So we'll do our fold of skin and verify our needle is 1/2 the length of that fold. Then we will clean our site, circular motions inside to outside, about 5 centimeters. We'll let that air dry without blowing or fanning it. All right, we're going to take our pinch of skin. Sub-Q, we will inject at 45 to 90 degree angle. Since it's heparin, we will maintain that pinch. However, with the other sub-Q injections, you can release that skin and hold support with the other hand. And we will inject slowly over several seconds. Since it's heparin, we will aim to inject this over 30 seconds. All right. Next, we will place our gauze. This is an anticoagulant, so we We'll probably be holding this for about 30 to 60 seconds. If our needle has a safety device, we can activate that safety device. Our needle will go in our sharps container. We can bandage this if needed. Gather our supplies and discard. We will discard our gloves and perform our hand hygiene and document our procedure.